So looking at the ADA guidelines again, there's a nice section that dot points those things that we should do as standard precautions. Undertaking hand hygiene before gloving and after glove removal, using protective personal barriers, so the PPE, gloves, mask, eye protection and gowns, wearing appropriate protective equipment during the cleaning process, appropriately handling waste, sharps, and appropriately processing of reusable instruments, so sterilising and disinfecting as appropriate to the level of contamination, so that critical versus non-critical versus semi-critical. Cleaning the environment effectively, respiratory hygiene and cough etiquette. So this is something else that's interesting and new as well, is what's the best way to cough to prevent transmission of infection. Using what's called aseptic or non-touch techniques where indicated, appropriately handling linen and clinical gowns, and where appropriate using environmental barriers such as plastic coverings on surfaces and items that may be contaminated but that are difficult to clean. So we talked about surfaces that we can't actually pick up the surface and put it into a sterilizer or dispose of it. So sometimes those surfaces might become heavily contaminated with blood, for example, so we may elect to put a plastic covering on that area which can then be removed and disposed of, whereas the piece of equipment can be retained. So have a look at the guidelines and make yourself familiar with each of these areas. I want to talk a little bit more about hand hygiene because, as I said before, hand hygiene is fundamental to safe practice and the prevention of infection. Hand hygiene is defined as any action of hand cleansing. So it can be, and is commonly, washing with soap and water, or it could be using a waterless antimicrobial fluid to rub the surface of the hands. But both of these approaches are designed to reduce, not eliminate, because we can't completely eliminate microorganisms from our hands, but to reduce microorganisms to a level where they're not then infectious. But I draw your attention to the soap and water. That is the most effective way to clean your hands, but you need to do it properly. This is a really cool picture which actually shows when a regular hand cleaning, so a person who is not aware of what's required for effective hand cleaning, if we ask a person to wash their hands and then we assess those areas of their hands that haven't been effectively washed, and studies will do this with an invisible dye which can then become visible, for example, so they'll paint the person's hands completely with this invisible dye. Then ask them to wash their hands, and then they will use some sort of UV light or something which then shows the dye, and therefore those areas where they haven't effectively cleaned. These are the areas that are most frequently missed. This is very important, the thumb. So the thumb is most frequently missed, as is the tips of the fingers. So if you think about how you wash your hands at home, think about why the thumb might miss out on effective cleaning. Okay, and then the blue shows other frequently, but the red are the most frequently missed areas. So when we come to learning how to wash our hands, yes, we will have to learn how to wash our hands because we don't know how to do it effectively at the moment. We're going to concentrate on techniques that will actually target these areas deliberately. I really like this cool picture as well. This is from Australian Guidelines for Prevention and Control of Healthcare. This is a really cool picture where they have taken a person's hand and pressed it onto some sort of plate. I don't know whether it's agar or some other substrate, but they've placed it on their hand on this to grow microorganisms. Now, on the left-hand side of the screen here, you can see that a person who's done an abdominal examination of a patient with no history of MRSA infection, but subsequently has been shown to have MRSA colonization. After that routine abdominal examination, so this is intact skin, the healthcare worker has put their hand on the plate, and you can see there the massive amount of MRSA that's then been cultured from that hand. On this slide here, you can see another hand imprint after the worker has cleaned their hands effectively with an alcohol-based hand rub. And you can see that there is no growth of those microorganisms on this side. So this is the difference between hand cleaning effectively and not hand cleaning effectively. It's quite dramatic, isn't it? Now, as I said before, we're actually going to have to learn how to hand wash. And these downloadable documents are available on LMS, and I want you to study them, and I want you to practice your hand washing. So you will see if you're washing with soap and water, there are 11 steps to effectively cleaning your hands. I want you to memorize those stages and force yourself to do each of those hand washing stages every time you wash your hands in a clinical setting. We'll be examining you on this, so it's a good idea to get it memorized now. Some of you, like me, might be horrified with how poorly you've actually been cleaning your hands in the past and how much microorganisms you are carrying around and eating your lunch with, etc., etc. It's quite disturbing, really. On this side is the hand washing or hand cleansing technique when you're using not soap and water but an alcohol-based fluid, for example. So a slightly different, slightly less steps because there's no drying or wetting of the hands in this process. But you need to know both of these things because in the clinical setting you will be using soap and water hand washing, and between soap and water hand washings you'll be decontaminating your hands frequently with a hand rub. Alright, so you need to know these things, so memorize and practice these steps. Now the hand washing or these hand hygiene procedures must be performed at particular stages of our care process. These are called the moments of hand hygiene. Alright, so you will see posters up that talk about the 5 moments of hand hygiene, and these are it. And it doesn't matter whether you're working in a hospital, in a ward, or in a dental surgery, the moments are the same. So at all of these moments in the care process, you should be decontaminating your hands through hand washing or hand rubbing. And the stages are: 1, before touching a patient, you should wash your hands because you don't want to transmit anything from your hands to the patient. Before performing a procedure on a patient, that is a moment of hand hygiene. After the procedure or bodily fluid exposure risk, you should be washing your hands again. After touching the patient, you should be washing or decontaminating your hands. And after touching the patient's surroundings, you should also be decontaminating your hands. So for us, the surroundings are the dental surgery, so the surfaces, the instruments after the patient has left. So at each of these moments in the care process, you should be hand washing or rubbing. It's important that you memorize those 5 moments of hand hygiene. And in the dental care setting, most of our care is provided whilst we're wearing gloves. So before we place gloves and after we remove gloves, our hands are decontaminated. Now, it's interesting when you look at the literature in the healthcare setting. This is data from the Hand Hygiene Australia database. So in healthcare, we are so serious about this hand hygiene because if you do it poorly, it spreads disease. and it spreads things like multiple resistant organisms, and they are very dangerous. So we actually have in place processes for monitoring whether healthcare providers are washing their hands properly or observing the moments of hand hygiene. And you, as students, will be subject to audit. So you will be observed and you'll be audited and then rated on how well you wash your hands. And if there are problems, you'll then be counselled and asked to remediate to demonstrate that you're able to clean your hands. That's how serious hand hygiene is in the prevention of infection. But let's have a look at the data here, because this is really very interesting. So this is data from that database that I talked about, where they examined a whole bunch of people working in healthcare environments. So nurses, midwives, personal care staff, medical practitioners or doctors, excuse me, student doctors, domestic workers, allied health students, student nurses, for example. And they showed, or they measured, the compliance rate. So the compliance rate is the rate at which people comply with the rules of hand hygiene. Now, not surprising, or maybe it is surprising to you, I don't know, the best hand washers in the healthcare setting were nurses and midwives. Nurses and midwives in hospitals were the best or most compliant, with over 80% compliance with hand hygiene. Guess who were the worst practitioners? Well, you don't need to guess because it's on the chart here. Medical practitioners. Doctors were the worst in terms of their compliance with hand hygiene, with less than about 70% compliance. Now, isn't that interesting? I'll leave you to speculate as to why doctors are not as good at washing their hands as nurses are. I'll leave you to consider that. But let's look down here at domestics. They probably need to be cleaning their hands more as well, although because they don't have direct patient care, maybe they don't think it's quite as important. But they're working in an environment where they could be picking up infection and then transmitting that to themselves or to others. That's interesting, isn't it? But it gets even more interesting. Let's have a look at this. So what I've done here is taken data again from that database to look at dental-only categories of workers. And what I've done here is just looked at the compliance rate, which is this column here. So here, all of these people, dentists, dental specialists, dental therapists, oral health therapists, dental assistants, student dentists, student dental therapist, student dental assistant, and dental technician, were all observed in the clinical setting. And the observer noted the moments of hand hygiene that occurred during that person's work. So this column is this column here is the total moments where hand hygiene should have happened. This column here is where it actually happened. And the difference between these two columns is the compliance rate. Okay, here are the confidence intervals. Don't worry too much about that. This is a statistical thing. But here, look at this. The best hand washers were dental therapists, dental hygienists, dental prosthetists, and oral health therapists, with a 95.3% compliance rate. Dentists and dental specialists were slightly below with 91%, but remember, they're still higher than medical doctors, and they're still higher than nurses. So in actual fact, these dental professionals here had a higher compliance rate than any of those on the previous slide. But within the dental group, you can see that therapists, oral health therapists, and hygienists and dental assistants, excuse me, were more compliant than dentists. The least compliant were dental technicians, but again, they have no clinical contact with patients, or at least they shouldn't. However, they are handling things like impressions that come from patients' mouths. Students, we can be a little bit tolerant. They are less compliant, and the student dentists were slightly better than the student therapists, although the student assistants were up there with the dentists. So I think what this shows us is that dental professionals are fairly good at hand washing. Okay, but we need to be better. We need to actually have close to 100% compliance, because this 10% or 9% of non-compliance it represents moments at which infection can actually be transmitted. So we need to have really good hand hygiene, but we also need to have this protective personal equipment. And here you can see this is a dental setting. There is a mask, there are safety glasses. These guys and girls are wearing a hat to protect their hair from splatter or aerosols from the patient's mouth. That's not always done, but they are using gowns to protect their clothes, because they will walk out of the surgery in those clothes, or into the tea room or into the restaurant, and they're wearing gloves here. Another thing we can also see is a barrier here, a plastic sleeving on the instruments that they're using. So hand washing and PPE are really important. Now, just a word about gloves. Commonly, people think that when they put on the gloves, it's 100% protection from anything that they touch. We know that gloves are not completely impermeable. They will allow things to move through them. So no gloves are 100% effective at preventing hand contamination. So commonly when people don't follow hand hygiene rules, they say to me, well, I had gloves on, so my hands, and I took the gloves off, and so my hands are clean. In fact, they're not, because there are small defects in the gloves that then let some contamination through. So the gloves protect our hands to a certain degree from heavy contamination, but they do not protect our hands 100%. And in fact, bacterial flora colonizing patients can be recovered from the hands of approximately 30% of healthcare workers who wear gloves during patient contact. So what that's telling us is that even with gloves on, 30% of the time, you will end up with microorganisms from patients on your hands. So that's why we insist on hand washing before putting gloves on, and we insist on hand washing after the gloves come off, because the gloves are not 100% protective. Okay, so keep that in mind. Really important, when gloves come off, we also wash to eliminate any potential contamination. So gloves should not be seen as foolproof. The other thing to keep in mind is our eyes are really important. It's very hard to work as a dental practitioner without eyes, or with eyes that are not working well. You need to protect your eyes, because things will fly out of patients' mouths at high speed. If they're soft things like aerosols or blood or something, then they may not physically damage your eye, but they can carry infection. We can also have things flying out of the mouth like pieces of tooth or pieces of filling material, which will actually penetrate our eyes and cause injuries, which are quite nasty. We also need to remember our patients' eyes are important, excuse me, too, so they need to be offered protective safety glasses. And our clothing should be protected from aerosols or splatters during the procedure, so do not wear a suit and tie while you're working on a patient. Make sure that you are wearing clothing that can be easily cleaned, and that you cover your street clothing or clothing that you wear outside the surgery with a disposable gown, or a gown that is then laundered. Okay. The other thing to remember is your feet should be protected from injury, because we can drop sharp instruments or spill chemicals, for example. And if we're wearing glamorous high-heeled shoes with uncovered tops, that might look fabulous, but it's not going to protect you from injury. Thongs or sandals also should not be worn in the dental surgery. And this is a protective thing. It's not about, you have to look daggy when you're a dental practitioner. You can get very stylish, covered shoes. And the last thing, one of the last things I want to talk about is sharps management. So we use a lot of sharps in dental care. The syringe or the needle is the obvious one, but there's also sharp instruments such as dental scalers and things that we need to take particular care with, because they can actually penetrate our tissues or the tissues of our patients and carry with it infectious agents. So the way we manage sharps is really important. We know that sharps injuries do occur in the healthcare setting, and we know from the statistics that sharps injuries are more likely to occur after the use of and before use of device, 40%, during the use of the sharp device, 41%. So what that's telling us is that there is a risk of injury to the practitioner or the patient during the use of the sharp instrument, the injection or the scaling, but there is an equal chance of someone being injured after it's been used, so while it's being disposed of or carried away from the operating site. So you need to take care when using the instrument, but also when disposing of the instrument. And the general rule is, if you generate the sharp, you manage it. So do not hand sharp instruments to someone else to dispose of. If you use a syringe, then you need to dispose of the sharp needle immediately after use. You do not hand it to an assistant, because during that handover, that's when the injury is going to occur. So the operator who generates the sharp is responsible for making that sharp safe. So I'm going to leave you now there, but I want you to pay attention to these two resources which are on the LMS for you. This one is specific to dentistry and is a more concise document. This one is a broader reference for you about infection control and prevention in the healthcare setting. Both of these are important for you to look at, to make reference to, and to use in addressing the intended learning outcomes for this session.